The liver unit at Royal Perth Hospital has a number of unique strengths. First of all, they have a particularly energetic and visionary leader in Dr. Wendy Cheng. She leads a terrific multidisciplinary team that really exemplifies the values of Servio, our hospital values. They look after a particularly vulnerable group of patients and they ensure they have equity of access. They work really well together as a team, but they also collaborate nationally and internationally, and of course within the hospital, both in terms of their clinical areas but also in research.
The Royal Perth Hospital Liver Unit is a strong integrated unit that uses several innovative strategies to improve patient care. It also has a whole range of state-of-the-art diagnostic tools to help us manage the patients. FibroScan is a non-invasive way of measuring liver stiffness and quantifies fibrosis in patients with liver disease and reduce the need for liver biopsy. It's a painless and quick procedure and it produces an instant result. It can differentiate mild disease from advanced fibrosis and cirrhosis, and treatment can be tailored according to the result of the FibroScan. Ultrasounds are routinely used in surveillance in high-risk patients for liver cancer. Using more advanced imaging technologies such as computerized X-ray tomography and magnetic resonance imaging, it can differentiate between benign and malignant lesions. Our interventional radiologists can also use angiographic technology to deliver chemotherapeutic drugs, embolic particles, or radioactive substances directly to the tumor. Patient hepatitis C, which is our biggest group of patients, we have a very comprehensive treatment program that uses a multidisciplinary team approach.
I was first referred to the liver clinic here from the Haemophilia Treatment Centre at Royal Perth after being diagnosed with hepatitis C. When I found out the treatments were getting better and better, I thought it was about time that I attended the hospital and had treatment. The staff at Royal Perth provided a lot of assistance and feedback and alternative ways to deal with some of the ugly symptoms of hepatitis C treatment, such as lack of sleep, itchiness and other things like this. From the number of patients that they've treated, they've got a whole list of ways of dealing with these things. My aim is to get rid of hepatitis C, so I'll continue trying whatever new and wonderful treatments there are available, and I'll keep on trying them until I knock it on the head. It's a big goal for me.
The studies that we do, in particular the international studies, offer patients a chance to access treatment which otherwise they would not have the chance to. This also allows them to try new drugs which are not available at present.
The services that were made available to me here that I would not have had elsewhere was access to the clinical trials. They put me on some trial medication that wasn't being used very widely around the world, so I was able to access that through this clinic. And I believe that being able to utilize that medication and the support I had here meant that I was cured much earlier. I was cured at all and was cured much earlier than I might have been if I was on traditional medication. I think it's vital that Royal Perth participates in these sorts of trials and allows us to have access to these experimental treatments or new drugs that are coming on. Somebody's got to try it out, and it's great to have West Australia is so considered so isolated, and often we don't have the opportunities here that they might have in bigger hospitals in America or other countries. So I think it's vital that we have that chance too to get access to those trial drugs.
At Royal Perth Hospital, we employ several innovative strategies to improve patient care. The first telehealth clinics for hepatologists and nurses were established in 2006 to cater for patients in remote and rural areas.
Telehealth was first established in Royal Perth for the liver service in 2006. We established the service mainly for patients who lived in the rural and remote areas. Patients normally would travel about 8.5 hours, sometimes overnight, to come for a half-an-hour treatment. And so we decided by establishing the telehealth service, we cut back on patients' travel. It's a very cost-effective and also patient-friendly program. We use telehealth to initiate patients' treatment. We can do patient education. Patients can be counseled regarding side effects and management. problems with depression. We also use telehealth to counsel patients for substance abuse. Basically, we use telehealth for all aspects of treatment. What the patient would receive in a face-to-face treatment can be done via telehealth.
It's always difficult to predict the future, but Royal Perth Hospital for at least the last half century has had a national, if not international, reputation for innovation and medical breakthrough.